Hi, this is Marian Arbisman, and today we're going to be talking about the types of questions that we look at in research and in clinical practice, and how we develop PICO questions. And this information will be very helpful for the next few weeks because for a number of the assignments and the activities that you're going to be doing in the class, you'll be looking at the types of research and really delving deeply into what fits a question, what research answers a question, and what research doesn't answer a question. In the area of research and in clinical practice, we ask many different kinds of questions. We ask questions all the time. And those types of evidence can be broken down into three different categories. The first is the descriptive questions. The second are the assessment questions. And the third, are the intervention effectiveness questions. And that is the typical type of question that we ask in evidence-based practice. Does an intervention make a difference? In the descriptive questions, we ask, what attributes and outcomes typify particular client populations and their daily lives and occupational performance? So we're asking, what does a clinical population look like, and what do the occupations that a person engages in look like? Are they different from those, without that specific clinical condition? So, for example, a question we can ask is, are there differences in play performance between children with and without sensory processing disorders? So that question asks, are the play activities, the people that children play with, the length of time that the child plays with, all of that information, does that differ between children who have a sensory processing disorder and those children who don't have a sensory processing disorder? And that type of information is really helpful in planning future research, but also in understanding what the needs of children with and without sensory processing disorders are. Another kind of descriptive question asks, what are the effects of visual impairment and age on driving? So that question is asking, we have driving performance. Does somebody's ability to see impact driving? And as one gets older, are there physical, cognitive, visual changes, all different kinds of changes, behavioral changes that really impact driving performance? And that also is really important to understand the clinical population, say for example, an older population that one may be working with in the area of driving. Assessment questions ask a slightly different kind of question. They look at the assessment measures that we use to determine what is going on with a certain clinical population. So those questions say, what are the most reliable and valid methods for assessing occupational performance in specific clinical populations? So those types of questions ask whether something is reliable. Can it be done again and again? So if I measure someone multiple times, will I get a similar result? Will I get the same kind of result? And is it valid? Am I really measuring what I'm looking for? So assessment questions examples of assessment questions can be, what is the most reliable measure for assessing the activities of daily living and instrumental activities of daily living, or ADL and IADL performance of children with autism? So what's the most reliable way I can understand a child's ADL and IADL performance? Another question could be, is X, meaning just a given measure that you find, valid for assessing changes in social participation for adults with serious mental illness. That question asks, if I want to see that an intervention that I'm using makes a difference and I assess someone, will that measure really measure the social changes that I'm looking for those people with serious mental illness? Intervention, as I mentioned earlier, intervention effectiveness questions ask the main core of what evidence-based practice is. And those questions ask, which occupational therapy interventions are most effective in achieving desired outcomes with specific types of clients? So an intervention question could ask, what occupational therapy interventions are effective in the rehabilitation of individuals with work-related injuries and clinical conditions of the hand, wrist, and forearm? So we're asking in this question, what works? And that is the core of what evidence-based practice is. The core of saying to clinicians, that clinicians ask, when I come in each day for clinical practice, am I providing the most effective interventions for that clinical population? And for researchers asking, I want to know, does this intervention make a difference? And does this intervention make a difference more in comparison to another intervention? Now we're going to move into another part of asking questions and developing questions. And this is really where we get more into the PICO section of this session, and also to get more into the assignment that you'll be doing and developing a PICO question. In questions that we ask for evidence-based practice, that we ask, and the same questions we ask for clinical practice, we need to target our question to the clinical population and to the intervention that we're looking for. So you have this PICO question, and what does PICO mean? The P for in PICO is the patient, the population, the problem, and the characteristics that you're looking for, the problem characteristics. The I is for intervention. The C is for the comparison. So as I mentioned previously, is there an alternative to the intervention? And the O is for outcome. What are the relevant outcomes that you are looking for? So when you're developing a PICO question or a focused question, and we talk more about developing focused questions because often all of the PICO components are not part of the focused question. So usually in evidence-based practice, they do talk about PICO questions, but also talk about focused questions. So the patient or the problem, the information that you're looking for to put into that P part is, how do I describe a group of patients similar to mine? You want to have the best balance of precision and brevity. So you want to make sure that you're being precise, because you're not looking at every patient in the world or every problem in the world, but you want to be brief. You don't want to be so precise that it takes you forever to describe the question. For the intervention, you are looking at, what main intervention am I considering? And you need to be specific in this area. You want to make sure that your intervention is really going to be specific. And again, you're not looking at everything in the world. And as you give more thought to this, and as this relates to the assignment, everyone wants to come into developing a focused question and solve all the problems of the world. For the purposes of this assignment, but also for the purposes of developing clear, concise, focused questions, you want to make sure that you are focusing on a specific intervention. Another tip for developing focused questions is that you, as I mentioned earlier, there may be a comparison intervention if it's necessary or available. And in that case, you would be asking, what is the main alternative to compare with the intervention? And you want to be specific. And will be available if you have questions about whether a comparison intervention is necessary for your situation. But please, this is not part of the PICO question, is not always a make or break situation in developing a focused question. And the last area for the outcomes are for what do I hope to accomplish? So is there a specific outcome, whether it's strength, whether it's a functional outcome, whether it's a performance outcome that you're looking for? Should you be specific with that outcome? So, and here's an example of an intervention question. What is the effect of interventions used in occupational therapy in the areas of self-care, education, transition, play and leisure, and social participation for children and adolescents with autism spectrum disorder? Now I'm going to critique this question because I want to critique it in comparison to what you will be doing for your work throughout this semester. This question is a very broad question. It's very long. It would take you a very long time to develop this question. But if you use it as a core and use it as a framework for the question that you're going to be developing, then you can whittle away different parts of the question to develop the one that you are looking for. So for example, let's say that your focused question, and it should not be specifically one of these questions, what is the effect of intervention used in occupational therapy in the areas of self-care? Maybe you want to stick to the whole area of self-care, or perhaps you want to look at feeding. So your question would be, what is the effect of interventions used in occupational therapy in the areas of feeding for children and adolescents with autism spectrum disorder? So as you go forward and develop your focused question, consider that you can start out broadly and then whittle things away to get the question that you're looking for. Or you could choose to start very narrowly and then build upon if you realize that your question is too narrow. So I will leave you with, keep asking questions. This semester is going to be there are going to be lots of questions, and I look forward to working with you on developing questions, asking questions, and using questions for your practice and for your research. Thank you so much. Bye-bye.